Daily care and management of dairy calves is a specialized activity. In order to achieve optimal health and prevent disease transmission, it is recommended that calves are separated from their dams at birth and raised individually until weaning. To achieve success in raising healthy dairy calves, it is imperative that they receive colostrum within hours after birth, as failure to do so will compromise their future health and survival. Dairy calves are separated and housed individually in order to manage them more effectively and for improved health. Separating calves at birth and housing them individually reduces the risk of disease transmission. Ruminants, such as these dairy calves, are born without immunity. This occurs because the structure of the bovine placenta does not allow transfer of antibodies from the dam to the developing calf. The only defense against disease during the first few weeks of life for a newborn calf comes from immunoglobulins that are found in the colostrum. These immunoglobulins, also known as antibodies, originate from maternal immune cells. When colostrum is consumed by the newborn calf, these antibodies are transferred directly across the intestine and into blood. The presence of immunoglobulins in blood then provides the calf with the protection against bacteria and pathogens in the environment. A calf that has not been given colostrum or has not received enough high-quality colostrum will have a compromised defense against the environment and consequently is at greater risk for disease. Separating calves at birth is an important management practice that reduces the spread of disease from mother to offspring. This is particularly true for diseases such as Johne's disease, which are transferred by fecal to oral contamination. Separating calves at birth and feeding them individually also ensures most efficient use of resources in the production of high-quality milk for human consumption. Milk replacer is frequently fed to calves as an alternative to fresh milk. This practice is often more cost-effective than feeding fresh, whole milk, and the formulation of milk replacers to standards for protein, energy, fat, minerals, and vitamins content ensures proper nutrition and a healthy start for young dairy calves. Separating calves from their dams at birth not only contributes to the health of the offspring and the dam, but also to the economic viability of the herd. Housing and feeding calves individually allows producers to better monitor calf health and growth, which serves to reduce calfhood diseases and calf losses. Furthermore, utilizing a nutritious milk replacer for feeding dairy calves is often more economical than diverting whole milk away from marketing for human consumption. Dairy calves should be housed individually until they are weaned onto dry feed, which usually occurs around 42 days of age. Young calves have a strong nursing instinct, and if they are housed together in groups, they display this behavior, leading to potential disease risks and future production losses. Furthermore, managing calves individually reduces the risk of disease transmission among calves should a disease outbreak occur. Hutches are an excellent option for housing young bottle-fed calves. Individual hutches can be purchased or built, and calves can be either tethered to the hutch or retained within an enclosed pen around the hutch area. When using calf hutches, it is critical to ensure the environment is clean, dry, and free of disease-causing bacteria. To minimize the risk of disease transmission from older to younger calves, the hutches should be cleaned and relocated to a clean area before accepting a new occupant. Areas where calves have been housed previously should be cleaned and given time to dry out before being reused. For calves and hutches, bedding should be kept fresh in order to keep the calves dry, healthy, happy, and growing well.
This presentation was a production of the Animal Science Department at Purdue University.